Hi, I'm Brandy G, the community MP,
And I'm Brandy B, the community MP.
and today we're going to be talking about COVID-19. We're going to talk about like what you need to know about COVID-19. As you guys know, COVID-19 is still here. It is real, and the numbers are tending to go up now. So we thought it was a very important topic that we needed to talk on, or touch on at this time. All right. So B, tell us, what is COVID-19?
So COVID-19 stands for Coronavirus Disease 2019. It's caused by a virus called SARS-CoV-2. And the virus first appeared the end of 2019, and then it quickly spread around the world, starting in China, and then it just kind of blew up from there.
Okay. So how is it spread? So it's usually spread. It's a disease that's spread from person to person.
Mm-hmm.
Usually, if someone coughs, sneezes, or even talk, you can spread the disease.
Mm-hmm.
It travels from tiny particles in a person's lungs or airway. It can travel several feet, so that's why it's important that when they tell you to stay 6 feet apart, that's why it's important, because it can travel several feet. It is easily spread from a person's living together. Like if you live in the same household, if you're going to restaurants, gyms, schools, or parties, that's why it's important that we social distance, because when you're in a close quarters together, it's much easily spread.
Right. Yeah.
It also can be spread by shaking hands, hugging, sharing food, and even singing together. So yes, when we're in a church choir singing together, we need to be 6 feet apart because it can spread.
Yeah. That's true. That's why it's so risky, like with the kids being in school, they're playing sports, they're in classrooms together. So I'm always scared about that. But luckily, I think kids are less likely to get COVID, and they're definitely less likely to have severe symptoms from it. So that's
So I
good.
guess that's why they have the kids wearing masks while they are, while they're at school.
Yeah.
So if they're at school, they have to keep a mask on.
Yeah.
So I'm just concerned if you can sing in a choir with a mask on. You know, that's like a big concern. I know that's one of my mom's concerns, why she wasn't ready to go back into the congregation, because she was like, she sings in a choir. The church is not that big, so she knew that she would be at higher risk.
Yeah.
Okay,
That is
okay.
risky because,
Okay. So who's at risk, B?
people at risk are, so like we said, anybody can get COVID, but the people that are most likely to have complications from it are people with serious heart conditions, chronic kidney disease, if you have type 1 or type 2 diabetes, if you have lung disease like asthma or COPD, sickle cell disease, obesity, of course, HIV, heart failure, high blood pressure. Those are the people that are at the greatest risk and at the greatest risk of developing complications.
Okay, so tell me this. I know you just mentioned it, but I want you just to repeat it. I don't have none of those complications. Can I get COVID?
You can still get COVID. And it doesn't mean, and even though you don't have any of those risk factors, you could still get like the complications that go along with COVID.
Okay. So it doesn't have a certain group of people that it goes to, and a certain group of people that can't get it. Everybody can get it.
Everybody can get it. Yep.
Okay. So let's talk about some of the symptoms. We know that symptoms can vary person to person.
Mm-hmm.
Symptoms usually appear 4 to 5 days after exposure, but it can appear up to 2 weeks after exposure. So I guess that's why we have that 14-day quarantine,
Mm-hmm. Yep.
because it can appear up to 2 weeks after. So what are some of the symptoms that you see when you have COVID?
So, like Brandy said, a lot of the symptoms, they vary person to person, but some of the most common symptoms are fever, a cough, and a lot of people say that cough has lasted them a very long time. So sometimes when everything else has gotten better, they still have that cough, which is risky because that is how you spread it. And then shortness of breath, feeling tired, being shaky or having chills, muscle aches, headaches, sore throat. Some of the newer things that they've added to the symptom list is um, the nausea, vomiting, diarrhea, decreased appetite, and then the skin changes. So like the tips of your fingers or toes may have like reddish purple spots, and then one of the other symptoms is loss of sense and loss of sense of taste and smell. So those were some of the symptoms that some of my patients had that made me think, oh, that's COVID, because that's not a common symptom.
So when I look at this list of symptoms, I see that some of the symptoms are symptoms that I see with the flu, with upper respiratory tract infections with my patients. I do see like 2 or 3 that I don't see that usually don't see with the flu, as far as the loss of sense of smell and taste, the changes in the skin color. So, so how can you differentiate? Like when your patients are coming in with these symptoms, are you doing other tests?
At this point, like with my patients, I have just been doing, when they come in with these symptoms, I just go ahead and do the flu and the COVID test, because there's no for sure way for me to determine which one they have versus the other without doing the test.
Okay. So how long does the symptoms last? Or do you have symptoms? Some people don't have symptoms at all.
Right.
And some people, I realize that the symptoms can last from days to months. So
Mhm.
even after the 14 days, they may still have some symptoms based on if they had complications. They may have symptoms
Yep.
that can last longer than the 14 days.
That's right. And then so a way, the ways that you can get tested for COVID, there's 3 primary ways. So there's the nasal swab, the blood draw, and the mouth swab. And the different types of tests are the nucleic acid test, which is the most accurate for acutely ill diagnosis. And then the antigen test, which is very quick. Some of them you can get the results same day, but the test is increased risk of false negative, meaning that the test comes back negative, but the person is actually positive.
Wow.
Yeah, and then the antibody test is the blood test, and it doesn't tell you if you are acutely ill. It tells you if you've ever had COVID. So that test isn't really useful, honestly, other than like I think they're doing some people can do like donate plasma if they have been if they've had COVID, just to help other people recover from it quicker.
So I think I was tested twice. So I had the nasal swab the first time I was tested, and the second time I had the oral swab.
Okay.
So tested I had.
So I'm sure that the oral swab was probably a little bit more comfortable than the
It
nasal.
was. I had to swab both sides of my cheeks and the top part of my mouth, and that was it.
Oh, well, that's good, because I thought at the beginning they were saying like to swab like it was nasal or throat swab.
Yeah. Maybe I did have to go to the back of my throat. I can't remember, but I know it was easy. It
Mhm.
wasn't as uncomfortable as the nasal swab. So
Yeah.
yeah.
I haven't got tested. I just, I'm,
I'm gonna have to ask you to go get tested. You're seeing patients, you're around patients.
I know.
So okay, so you are an example of a person who does not have symptoms.
Mm-hmm.
You're around, you're seeing patients every day, you're in that population. Some of your patients do test positive. Even though you're wearing PPE and you're protecting yourself, I think every now and then you should go get tested.
Yeah, just me on the safe side, because I
Yeah.
think you told me earlier that, even though I feel fine, I don't think that I have it. My family feels fine, but I'm a carrier and I am around someone with a compromised immune system? So you're right. I
Yes.
get tested every now and then.
Yes.
I'm scared.
That's okay. You're gonna be okay. You
But
getting tested may save someone else's life. So
that is
look at it like that.
that's very true. You're so thoughtful. So let's go through some scenarios
Okay.
that people, go through in their head. Like, I got this. What do I do? So let's start. Okay. So Brandy, I am at home and I'm feeling sick. So I feel like I'm developing symptoms. What should I do?
First of all, you should call your primary care provider
Mm-hmm.
and go get tested. Okay. Go get tested. And
Okay.
quarantine. You need to quarantine.
Okay. So what do I need to do if I develop like severe respiratory symptoms? Like I'm having really hard time breathing and I just feel very uncomfortable.
Go to the ER. Go to the ER. If you can call ahead to let them know that you're coming, do that. If you do not have a car and you cannot take yourself to the ER, call 911 so
Okay.
you can be transported to the ER.
Okay.
Okay. So what if you think? So I think that I was exposed, but I feel fine. So if that happens, what should you do?
You should still get tested, and the recommendation is to self-quarantine for 14 days. Even if your test comes back negative, you have to finish your 14-day quarantine. And the reason for that, I see the look on your face.
Because what if I work? What if I have a job and I work? Like, what if I work and I have to go back to work?
Well, there are like laws and regulations now that kind of help, I guess, protect people's jobs. But the reason is because, as we said before, symptoms can develop within those 14 days. So got to play it safe, not just for yourself, but for the safety of others too.
Okay. So what if somebody in my household tests positive, but I was negative, but my daughter tested positive or my husband tested positive? What should I do?
So then, the person that is infected needs to isolate, try to keep them in one room of the house. And then everyone else needs to get tested. And then you still have to quarantine for 14 days. Now, one thing is, say, you're on day 7 of your quarantine, and then another member of your family gets sick and you've been around them and they test positive for COVID. Your 14 days starts over.
Oh, wow.
So you
So
can be
it's
out a while.
okay. Wow. Okay. So I tested positive. I've done the 14 days, okay?
Mm-hmm.
So I'm ready to go back to work. Do I need to go get retested again to have a negative test to go back to work?
No, so the CDC says you don't have to get retested unless you get re-exposed, your symptoms, like say your symptoms are getting better and then suddenly you're sick again. So then you can get retested, but you don't have to get retested.
Okay.
If the job requires that, then that's just one of their own rules, but that's not what the guidelines recommend.
Okay. So I tested positive. Say that I tested positive.
Mhm.
I did the 14 days. Isolated myself in my home for 14 days. When can I go back out into society? When can I go to work, go to the grocery store, just leave my house?
So basically, if you test positive, you can be around others after 10 days since your symptoms started, and you
Okay.
have to be fever free for 24 hours, and the rest of your symptoms have to be improving. So if they're not, like the loss of taste and smell, those things need to be getting better. Your cough should be getting better, and still you can go be around other people, but you need to wear your mask.
Okay. So do I still have to social distance when I'm around other people?
You should
Do I
be,
have to still stand 6 feet apart?
yes, because everyone should be doing that.
Okay.
So regardless of if you have COVID, had COVID, never had COVID, you still need to social distance, wear your mask, and maintain that 6 feet, 6 feet
Okay.
apart.
So I know with COVID, just looking at TV, it's very stressful. It can cause anxiety. It really makes me anxious. So we have to come up with ways how to reduce the stress and anxiety. So some of the things that I've been doing is taking a break from the news, turning the television off, trying to exercise, even eating healthier foods, finding other things that I enjoy, like watching a movie, playing a game, FaceTime with my daughter. Like I just been trying to find other things just to take my mind off the stress, the anxiety that I'm getting from COVID.
Yeah. That's good because, like she said, people are developing anxiety. People are getting depressed because, we're quarantined in our house. We can't see our friends. We can't see our family. And so those are things that, we have to find ways to deal with.
Okay. So while doing that, we still have to protect ourselves by washing our hands, wearing our masks, and avoiding large groups. I know that the holidays are coming. Thanksgiving, Christmas, and people are usually gathering together for the holidays. Like I love to be with my family for the holidays. We love to have a potluck. So I mean, this year like things are going to be a little different because the numbers are going up. Just so everybody can be safe. Things may have to change this year. You may have to do a FaceTime Thanksgiving celebration or Christmas celebration.
So sad, but like that's literally what we have to do to protect our families. Especially if you have like older parents or family members that are sick, definitely don't want to be like in a crowded place with someone that has cancer or some of the other health risks that we discussed, just because you put them at higher risk of getting sick, and they're going to have a hard time recovering from it.
Okay. Okay. B, I think this is some good information about COVID-19.
Yeah.
I really do.
So if anybody has like specific questions or there's a scenario that we didn't cover, then you can leave us a message, contact us, Facebook, Instagram, or on YouTube. This video will, of course, you'll see the video on YouTube, but also, so just subscribe. We appreciate you guys' support. Y'all have actually been really amazing. We were kind of skeptical about starting this venture, but we're glad we did because it's been fun.
Yes, it has. So just remember that if you need any more information about COVID-19, go to cdc.gov or INT. Yeah. So, okay. Well, follow us. Like she said, you didn't tell them where to follow us at, Brandy.
I'm sorry. Follow us on Instagram and Facebook and subscribe to our YouTube. We are B&B, the Community MPs on all platforms. And remember that
community is our beauty.